Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you?
Doing well, thanks.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, US COVID statistics, and answering a viewer-submitted question submitted through today, May 16th. We invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, average COVID deaths per day, the only statistic currently being reported, is at 42 deaths per day. Last year in 2023, the same week, we saw 135. Dr. Murphy, your comment on that number and why only this number is being reported.
Yeah, well, good questions. So this number, 42 deaths per day, remember that translates to 15,000 people per year. So this is not insignificant. Now, it's certainly a lot better than 2023. So we've improved really remarkably, but it's still a lot. So that's one thing. The other thing is, why are we just talking about deaths? Because that's the only thing that is reported now. The reporting of hospitalizations, the reporting of new infections is over. We don't have that anymore. Many of the states stopped complying. It's all voluntary anyway, and it was just no point trying to deal with half of the information that they needed. But the deaths are real. So, if that's the only thing we have, that's the only thing we have. If that starts creeping up, we've got the systems in place to go back to reporting new diagnoses and hospitalizations.
Mm-hmm. Now, our viewer submitted question for this week comes from a viewer who saw an announcement from the WHO and would like to hear your opinion on it. So the WHO's announcement was on a kind of traditional or dogma on how airborne diseases spread. Can you tell us what the change is, why, and does it make sense?
Well, most of the infections occur within a 2-meter radius of the person who's infected. They're coughing and it's getting in the area. The big question always was, does it really just go airborne? Can those particles just kind of go everywhere, like everywhere on an airplane or everywhere in a room? We've actually known for a long time that can happen. So that's called airborne. And the WHO finally just said, yeah, it's an airborne disease. So you have to treat it like tuberculosis or anything, any disease like that. It's a little bit semantics. We've already sort of known this, and I think the CDC will follow along with the WHO and will be at least consistent. We've known for a long time that, people in closed areas, especially with the way the ventilation works, we're getting infected that we're nowhere near an infected person. So this is really nothing new. At the beginning of the pandemic, you may have remembered that we thought up to maybe 6% or more was due to environmental causes, like, you touched a screen that on your computer that somebody else had touched, that had it on their hand. It's this environmental transmission. It turned out it's a lot less than it's the big problem is airborne.
Mm-hmm. So thank you for clearing that up for us. I, for one, was a little confused reading through the semantics of that, so I appreciate your expertise there. Now, our first story, of course, is about the avian flu, H5N1. There have been a lot of updates in the last week, specifically regarding wastewater and how labs are handling bird flu samples. Can you break into those for us?
Yeah, so the Baylor College of Medicine in Texas did some research here. It looked at 9 Texas cities looking for H5N1 avian flu, and they found a lot of it. 19 to 23 sites had at least one detection of confirming that H5N1 was there. And so it's not clear where the virus, doesn't tell you where the viruses are coming from, but the evidence still tilts towards animal source because the researchers didn't see any mutations with known links to human adaptation. So far, so good. However, you know, they continue to look for this in wastewater, and they've been finding it kind of in more places than you can imagine. And they've also found it in 46 dairy herds in 9 US states. Several more were just found in the state of Michigan, by the way. And so it is spreading in the cattle, in the dairy herds. At the same time, the US government has relaxed their strict guidelines on how public health laboratories handle and store H5N1 samples. The reason they did this is they were afraid the samples wouldn't be handled at all and we wouldn't get any information. And so it's basically going to be handled just like any other flu, which has its own restrictions, by the way. So I don't think it's any big deal that we have to worry about. But the good news is that in all this data is that although the cows are getting it, the number of cases in humans is still relatively low and mostly limited to dairy farm workers.
Yes. We will, of course, keep our eyes on this situation and keep reporting on the new data as it comes out. But now we're going to transition over to COVID research, newly published about prior COVID infection versus vaccination and the timing of those things and how much protection they offer. Can you break down the study?
Yeah, so this is a study in the Journal of Infectious Diseases, highly reputable study from Cedars-Sinai Medical Center in LA, a highly reputable medical center. And they looked at a cohort of about 4,500 adults. And they studied them during the beginning of the Omicron wave. And they looked at two groups of people within this 4,500 people. So those who had recent COVID vaccination within 90 days of the onset of the study, and those with remote vaccination or a previous infection greater than 90 days prior to the study onset. So they found 2,053 new infections occurred. And they found that there was a significantly lower risk for new infection in the next 90 days. And then they looked at the age interaction, and they found that remote vaccination over 60 years of age were at significantly higher risk for new infections and no increased risk in those under 60. So that's kind of that is the cutoff in this particular study. Over 60 does worse, even if you've had a prior infection or a vaccine. And at the end of the bottom line is prior infection and prior vaccination both give protection. However, remote prior infection was less protected than remote vaccination in everybody 60 years of age and older. So we all know that immunity to COVID goes down, and that's why you have to keep getting vaccines or you're going to just keep getting infected. But the key thing here is that if you're over 60, you really have to try to keep up with the vaccination schedule. The vaccines work better than having the prior infection. It may sound counterintuitive, but the vaccine people have known this for a long time. The vaccines present an antigen, which in this case is part of the virus, to the body in a much more vivid way or more potent way than the actual infection itself. A lot of people just don't think that would be the case, but that is the case. And the vaccine actually gives more protection than just having prior infection. They both give some protection. And then 60 years of age is kind of the cutoff to where that protection really begins to wane.
Yeah, we'll be looking out for the announcement of the next round of COVID vaccines that are formulated, and of course, more information if there are decisions made on which strains will be targeted. But moving on a different subject, malaria cases have been increasing in certain areas of the US. Can you explain where and maybe why these cases are happening?
Yeah, so there's been 41% more imported malaria cases in 3 southern border cities in 2023 than in 2022. So typically we have about 2,000 cases of malaria imported into the United States per year, mostly in people coming, from countries where malaria is very common. However, what's happening is we're having an increase in imported malaria, and but of the 68 cases found recently at these sites, 22% were found in U.S. residents. Well, 78% were in the new arrivals, the migrants or other people coming in across the border. This can result in severely ill patients if it's the first time you've ever had malaria, which most Americans have not had. 19 were hospitalized, nobody died, which is great. But I mean, that could happen. And so what you're seeing is malaria is in these areas where there's a lot of malaria coming across the border, or if they go to any other city, it doesn't have to be a border city, and they get malaria, it can kind of spread if those mosquitoes are there to other residents that have not traveled and are just living in those areas. So malaria is another problem we have to be careful of. Right now, it's limited to the border.
Mhm. Yeah, mosquito-borne diseases have been on our minds very much this season with the very wet and hot conditions. But moving on to some more positive news, there are 3 more countries that have officially eliminated both congenital HIV and syphilis. Can you tell us about these countries and what do they need to do to get that certification?
So they have to show to the Pan American Health Organization, also referred to as PAHO, how many new cases of HIV and syphilis there are. They have to have a screening program that's acceptable to PAHO. And in the last year, Belize, Jamaica, and St. Vincent and the Grenadines were the latest to eliminate mother-to-child transmission of HIV and syphilis. And so they join a host of other countries, including Anguilla, Antigua, Barbuda, Bermuda, the Caymans, Montserrat, and St. Kitts and Nevis, which achieved that goal in 2017, and Dominica in 2020. So basically, they've really cleaned up this congenital syphilis and HIV. Now, meanwhile, in the same time in the US, although we've done a very good job with mother-to-child transmission of HIV, the number of congenital syphilis cases significantly increased over the last couple of years by 17 and 30.6% respectively in 2021 and 2022. So the numbers are going up for congenital syphilis. I mean, this is just grotesque that this is happening, because this is a totally preventable disease. Now, most of these women that come in, if you drill down into the data here, had like little or no prenatal care. They're just showing up, delivering a baby. And by then it's too late. The baby's already infected. So that seems to be the problem in the United States, and it's growing. It's really sad.
Yeah, and something that we've talked about in previous weeks, just a very upsetting issue, and hopefully one that our public health systems can really start to get their hands on to fix. But another positive ending note for today is that the UN agency has authorized a second vaccine to fight against dengue with these huge outbreaks we're having in the Americas. Can you tell us about the vaccine and hopefully the effect it can have in these situations?
Yeah, so there's a second vaccine for dengue that is approved by Takeda. So it's a 2-dose vaccine for dengue, and it's shown to be quite effective. So why is this important? Well, the last year was just a disaster for dengue in the Southern Hemisphere. I mean, millions and millions of people got it, and they had really a paucity of vaccines. So this is just great news that yet there's another source to treat in the next wave of dengue viruses. Now, dengue tends to go in these 4-year waves. So last year was really, really bad. And hopefully next year it'll go down now that there's some immunity, herd immunity to dengue. It probably is going to go down, but now it's now that if it is needed in a certain area, pocket area, there's at least 2 companies that are making vaccines that are WHO approved.
Mhm. And it's very important. Even this year, there have been over 6.7 million suspected cases, about 3 million confirmed cases in the America alone. That data was again from PAHO that we mentioned in the last story. So really great that we have another vaccine coming out. Hopefully we can increase that supply.
Absolutely. The more the merrier.
Mhm. Well, on that note, thank you very much, Dr. Murphy, for your expertise breaking down the headlines, the latest research, and answering our viewers' submitted question regarding those WHO changes. It's much appreciated.
Thanks, Katie.
And thank you all for joining us for another episode of Ask Dr. Murphy. Again, if you have any questions, please feel free to submit them down below by email or any of our other socials in the description. We'll see you next week.
Bye-bye.